recommend it, but you know, I still just put up with it. When I entered perimenopause, I was experiencing quite debilitating symptoms, and I mentioned this to my GP, who said it was vaginal atrophy. And as I was already taking HRT at the time, they said that that should, you know, resolve it. Obviously, it didn't, and I had quite a job on my hands getting something topical prescribed in addition to the HRT patch. So I finally got topical estrogen, and it did help with some things, but just not all. And at that point, I joined a vaginal atrophy Facebook group set up by Jane Lewis, who was also the editor of Me and My Menopausal Vagina, which actually, you know, it's a brilliant book. If anyone wants to have a read of this one, you know, I can bring it into work. It was a revelation, I think, because here were people talking really openly about vulvas and vaginas, you know, the good, the bad, and the ugly it was. But also, I think up to that point, I'd never even looked at mine before. It had never really occurred to me to do so, even though I was having issues from kind of a very young age. Obviously, other people have looked, you know, partners, GPs, the smear nurse, the numerous people that were involved when I birthed the two children, one of which I had an awful time with, and so it was pretty much a free for all. But you know, I'd never looked at it myself. And it was in Jane's group that I first came across the words lichen sclerosus. And at that point, I was led to Clare and Emma's Facebook group, which the last time I checked has over 13,000 members. So, you know, a lot of people in a similar situation. So I went along to the GP, armed with all the information I got from that group, but no, it was put down to vaginal atrophy again. So it was only when, the day before COVID, I had an appointment with my menopause specialist because I was having some kind of breakthrough bleeding. She'd said at that point, right, what we can do is we can insert the Mirena coil. If you want it, you haven't got time to think about it because we're going to go into lockdown tomorrow. So if you want it, we need to insert it today. So I was like, right, okay, then let's do that. So as she was inserting it, I kind of said very candidly, Diana, you know, just like while you're down there, would you mind just checking? Because I've read about this lichen sclerosus. Do you think I've got it? And that's how I found out. She was kind of aghast that it hadn't been picked up previously. She was like, oh yeah, you've got quite kind of, you know, severe symptoms. Have you not been given anything from the GP? I was like, no, you know, he said it was vaginal atrophy. Having it right. So then she'd said, well, because we're going to lockdown tomorrow and you probably won't get in to see your GP, I'm going to write you a prescription now. And so that's what I had. She'd give us a prescription for a steroid cream, went on my merry way. And so finally, I had the treatment. And I think it was such a relief after years and years of discomfort and just putting up and also being a little bit ashamed and a little bit embarrassed, you know, about discussing vulvas, vaginas, and all and everything else in between. So I think that's why I'm so thrilled that Claire could be here to join us today to highlight the condition and also to tell us her story of how she became an advocate for raising awareness both of lichen sclerosus and also vulval cancer. So over to you, Claire.
Thank you, Louise, and thank you for inviting me, because it's very important because, like you say, health professionals aren't really aware of both LS and vulval cancer and often does get misdiagnosed. Like, my history is that from the age of about 5, I remember symptoms, itchy and sore, found it uncomfortable sitting on the floor, like when you're in assembly at school, or sitting on the hard chairs. I couldn't keep still. I was always called a fidget, always told off. My mum, early memory I remember of about 8 or 9, mum could hear me crying in the bathroom because when I went to the toilet, the urine just stung. So I was trying not to go. I wouldn't drink anything. So she took me to see the GP. Obviously, as an 8, 9-year-old male GP, extremely embarrassed. He never asked to look, and my mum done all the talking and just said that obviously it burns when she goes to the toilet. Wasn't asked any other questions, so he just assumed it was cystitis. So gave me treatment for that. Went on my way. It didn't make any difference. I then did keep it quiet for my mum. I didn't want to go back to the male GP. It wasn't until I was older that I did, but it did sort of go into remission by itself, which is quite common. Originally, they thought that it only affected young or old women in the genitals, but now they're realising that quite often it can go into remission early age after puberty and then come back out again later on in life. So I carried on for a few years, okay, no symptoms really. It wasn't until my early 20s that I started to get the symptoms back. Again, itchy and sore, intercourse would be slightly painful. Didn't really notice any difference. I wasn't looking like yourself. You're not really told to look, so I didn't really look. Didn't know what I was looking at or what it would, what to compare to either. I had my smear tests as well. Again, nothing was ever said. Everything seemed fine. Went to the GP numerous times in my 20s and 30s, more than 10 times. I did see different GPs, all male. None of them asked to look. They just said it was thrush, so I was given thrush treatment every time. Went away, I self-treated as well, would carry on buying thrush treatment myself. I sort of done a little bit of Googling back then and just thought, maybe itching is normal. So I would buy Vagisil, all sorts, pseudo cream. Nothing really made it any better. If anything, it was making it worse. I had 2 children in that time as well. I had to have a C-section for both, for other reasons. But still, they did look there. Again, nothing was said. It wasn't until I probably got late 30s, I then saw a different GP who was a female GP, and she was actually the first person actually asked to look, and she took a swab for the first time. Didn't even know you could have swabs. That came back negative to thrush. She then done a blood test, thought maybe it could be diabetes related, symptoms in the vulvar area for that. Again, all come back clear. She then said it was probably menopause symptoms early. Wasn't given anything for it, just told maybe it was that, and that was it. So off I went, none the wiser, carrying on self-treating, trying different creams. I then got a tear in the perineum area, which didn't heal actually. It was probably there for quite a while. I even had one of my smear tests, which I believe I had cancer at the time, but again, nothing was picked up. I went back to the doctors after 3 months because the tear had turned into like an ulcer. And it got to the stage where sitting, going to the toilet, touching was just too painful. I didn't really want to go back because obviously all the other times just kept getting told it was thrush, but I did go. Saw another female GP, and again she asked to look, and she said it was herpes, and told me to go to the gum clinic, which obviously I was shocked at, and I wouldn't have gone. Luckily, she made her think twice, and then she asked me how many partners I had, and I said, well, just my husband for the 25 years. So she asked to look again, and then said, actually, I'm going to send you for a biopsy. Please make sure you go. You should hear within 2 weeks, which I did. I went and had 3 biopsies taken, went to get the results, and when I walked into the room, there was a nurse with a box of tissues in her hand, and the doctor, so I thought this isn't going to be good news. And that was when I was told 3 things that day that shocked me. One, I had a vulva, because I never knew. I never called it a vulva. I always called it down there, or privates, or vaginas. That was a shock. Then I was told I had Lichen sclerosus. Again, never heard of that condition. And then I was told that I had cancer, which again, never heard of a cancer in that area. So vulvar cancer was the first time I'd heard that. So it was quite a shock to get told all those. I was also quite angry as well, because obviously all the times I had been misdiagnosed, I was then told that it was the untreated, undiagnosed Lichen sclerosus that had caused my cancer. There are several types of vulvar cancer. Not all are Lichen sclerosus caused. Sometimes it's HPV virus. There are other skin cancers as well, but my one was due to Lichen sclerosus. I was then given scans, MRIs. All that took about 14 months. I won't go into that because it would take ages. But I've had 5 surgeries, lots of treatment, took 14 months. Obviously that left me with early menopause because I had pelvic radiotherapy, instant menopause at 43, loads of other conditions caused from the cancer. But going back to the LS, during the treatment I had lots of time on my hands, so I spent that researching, looking on social media, finding charities. Couldn't really find anything on Lichen sclerosus or really much on vulvar cancer either. And I was quite angry that I had 8 smear tests in that time, and I had all the symptoms from my child, so I ticked every single box. So the fact that no nurses or GPs had picked it up, I wanted to know why. And I was told that unfortunately nurses aren't trained in vulval diseases. Even though they have to look at the vulva to get to the vagina, and the cervix are not trained. So unless they decide to take a special interest themselves, or they know somebody with it, or they learn their own way, they're not automatically trained. And even GPs, some admitted to me they've had no training, didn't know about it, or only very little. Again, same as menopause really. So, you know, that's why it's not picked up. Charities as well, there wasn't really any charities. The gynecological charities seem to concentrate more on ovarian cancer and cervical. Because vulval cancer is a rare cancer, they just don't care really. There's no money in it for research or for awareness. Lichen sclerosus, they always assumed it was a rare condition. They're now realising that it's not rare, it's actually common. They say at the moment it's about 1 in 100. But unfortunately that's going to be, you know, nowhere near that, because many people like myself will have been self-treating, misdiagnosed, too embarrassed to go, so that's probably a lot higher. Although lichen sclerosus is more commonly in women, it can occur in men as well, and it can be any ages, and not just the vulvar area. It can obviously affect the whole body. It's just more common to be in the vulvar area. So really, because of all that, it sort of made me decide to do more. I wanted to get change, so I helped the charity do some training, which are for points for GPs and nurses, in vulvar conditions. Also raise awareness, mainly on social media. I also do events, I do things like this. I'm a patient advocate as well on many different research projects. I work with quite a lot of the top doctors in changing things and trying to get more awareness. I also started my own vulvar cancer support group where there's over 400 of us from the UK in, because there are quite a lot of American sites, but I wanted one that was just really for those that live in the UK. I then joined Emma Norman, who had already just started the lichen sclerosus support group. Again, there's lots of American sites which give, unfortunately, wrong information. So I joined them and became admin on there, where I've been for sort of 7 years. Like you say, there's just over 14,500 in that group now, and noticing that they're getting similar, told it's thrush, or you haven't got it, or you're too young, the wrong information about steroids. So, you know, that's why I do some of the training that I do. I work with the BSSVD, also the Royal College, Obs and Gynae, for training, and just really try and help really to get the word out.
Yeah, worryingly, I did. My youngest was having issues, and she's 12 now, and that was put. I'd kind of said to the nurse, "Could it be?" Because I was just so kind of afraid in case it was, and she was like, "No, no, it's very rare. It's very rare in young girls." And yet I'm thinking, well, I ended up having it, so it's not kind of that rare. Um, would you mind, Claire, just explaining how lichen sclerosus differs from your typical vaginal atrophy, and what people can kind of look out for? As you say, the GPs are not that well versed on it, so I guess we all have to advocate for ourselves. But what can people look out for?
Well, I suppose in a way, because there are quite similar symptoms and signs with thrush, vaginal atrophy, and lichen sclerosus, and other conditions actually the vulva, even dermatitis is similar. So I do understand why it can be hard to get a diagnosis, and treatment sometimes is hard. And of course, you know, you can have more than one. You know, many of us will have lichen sclerosus, vaginal atrophy, dermatitis, you know, thrush all at once. So it is hard to get a diagnosis. But really, I think the most important thing is, like you say, is checking your vulva, making sure you know what your normal is, what your vulva looks like. So then if you're checking regularly, at least once a month, like we're told to check our breasts, then you know what your normal is. So if you see something different and it's still there within 2 to 3 weeks, then, you know, go back to your GP and say, this isn't normal for me. But the symptoms for lichen sclerosus are similar to vulvar atrophy. You can look thinning of the skin, can look like it's thin with lichen sclerosus, although quite often it's thickening of the skin. You can have sore areas, sex can be painful. Lichen sclerosus is more pale skin and white, whereas vaginal atrophy can be paler skin, but not necessarily white. That's normally can be red. And the same with thrush. Again, that can be similar symptoms with itching, and you can have sore areas. So it's difficult to tell the three. You know, whereas the vaginal atrophy affects the actual vagina, so inside, whereas lichen sclerosus is extremely rare to affect inside. I think only three people have been reported to have biopsies confirmed inside. That's normally lichen planus. So lichen sclerosus is outside the vulvar area. So that can obviously be the whole area, figure of 8, also the anal area as well. So it can affect the whole area. as well as other parts of the body. So yeah, it is quite hard to tell. You know, even some consultants sometimes can find it difficult to tell the difference between the three, which is why quite often you've got to treat all three, and just, you know, keep a diary as well, so you know what you're using, what helps and what doesn't help.
So in your opinion, do you think it's more than every 1 in 100? Obviously, because people, you know, don't kind of verbalize that they're having issues for, you know, embarrassing or whatever.
Definitely. Whenever I've done talks like this, you always get some that will say, actually, I recognise those symptoms, and many have gone on to get a diagnosis of lichen sclerosis. Whenever
Right.
Also, when I've used my own social media, some friends have been diagnosed with it. I even one that saw a post when I first was diagnosed actually got early diagnosis of cancer because of it. So yes, it's definitely, there are people out there that are either ignoring the symptoms, think it is something else, self-treating for thrush, too embarrassed to go to their GPs. So yeah, there definitely is going to be more. The same with whether they know whether it's going to be hereditary or not. Unfortunately, a lot of families don't talk about it in our support group quite often.
Right.
They don't tell their parents, they don't tell sisters, they don't tell any family members. And when eventually they do, you'll get an auntie or a sister say, oh yeah, I've got that as well. So they're not talking to each other. And because of that, it's harder to get to know whether it's hereditary or not. You know, they think, you know, that there is going to be a family member that could have an autoimmune condition, especially thyroid, linked to it. So yeah, definitely. Whenever I've done any of these talks, someone will come up to me at the end and say, actually, I have it, or a few will recognise the symptoms and get a diagnosis. So it's definitely more common. And even when they say that the age that you're too young, you're never too young. There are a lot more in our support group in their 20s and 30s that are getting diagnosed. This is just my opinion, but I think the reason why it is more aimed at those in menopause age is because of what I've just said. It takes that long to get a diagnosis. You're ignoring it. You're maybe not as embarrassed when you get older. You know, you've gone to the doctors maybe with menopause symptoms and it's discussed more. So then you're discussing that, and then that's when you're diagnosed. So I think that's why more are getting diagnosed sort of over 50. It's because, you know, you get to that age and maybe you've got more symptoms of menopause. So together with lichen sclerosis, it's making the lichen sclerosis worse. So you're noticing more of the symptoms more, and you go to your GP.
Right. And do they know what causes lichen sclerosis? I know you'd mentioned that it is kind of or it's linked to an autoimmune condition.
Yeah, they're not really sure. Some doctors are doing some research in it, and they believe that it is probably more likely autoimmune. But you know, not only a small percentage do have other autoimmune conditions, but might have a relative that has thyroid, for example. That can be quite common. They think it could be hormonal, trauma. You know, they're really not sure. I think it's because we're all so different. It's hard to say because I have no other autoimmune diseases, where somebody else with LS might have about 5 more. So they're still not sure. It does seem to be going down the route of autoimmune, but they're definitely realising now that it's also not rare. So hopefully now, because of that, there will be more research done for it.
Yeah, definitely. But unfortunately, women's health isn't really given that much priority or funding, unfortunately. I mean, it's just, I was just aghast at the fact that, you know, the GPs and the nurses don't have any kind of vulval training, which, you know, for the vast majority of the population, wouldn't you have thought that would be? But I mean, it's a similar thing for menopause training. You know, it's like half an hour, isn't it, out of the 4-year course. And I know we had Diane Danzig have a session with us last month, and we'd mentioned there about Vagifem, which is a vaginal atrophy tablet that people can use. And we'd also mentioned that there is one that's available over the counter called Gina or Gina, I'm not sure which it's a similar tablet. I remember when that did come about, only because I was always told that it was vaginal atrophy, and my fear is that someone might think, oh yes, I've got some similar symptoms, might pop down to Boots, you know, get this Gina, and so potentially they could have lichen sclerosis and it still remained untreated. I think that's the danger of having things like that available over the counter without proper consultation.
Yeah, definitely. We have noticed, I've spoken to a consultant dermatologist actually about this, that because it's great to see a lot more awareness with menopause, but because of the awareness of menopause and vaginal atrophy, she's seeing a lot of people in her clinic that are getting misdiagnosed with lichen sclerosus, and they only have vaginal atrophy, and also vice versa. So some have both, one or the other. So that you're seeing a lot more. So some doctors are getting more aware of LS, but are assuming that's what they've got when they've actually haven't. So obviously both treatments are different. So yeah, there is obviously the danger of that when anyone self-treats or gets anything like that. We do need to see specialists really, and it needs to be really a consultant dermatologist, because it's a skin condition. So although gynecologists and GPs can also diagnose and treat, they don't often have as much training as consultant dermatologists do have, and they don't necessarily do the updates and do all the training for it. So in my experience, it does need to, LS does really need to be treated and diagnosed at first with consultant dermatologists, but unfortunately the waiting lists are so long, it doesn't often happen, and quite often they're under pressure now to refer back to GPs, which is great if you've got a GP that knows what they're doing, but if you haven't, then it's dangerous, because lichen sclerosus, although it's very small, only between 2 and 7% of those, and normally that's with untreated LS, can turn into vulvar cancer. It needs to be seen by a specialist.
Yeah, definitely. But we've already touched on kind of treatment. So I was prescribed a steroid, although not really told how to use it. And I think there's a lot of misinformation on there. Would you mind just touching on that, on the treatment and how you use the steroid cream?
Yeah, of course. That's another thing as well, which if you see the wrong specialist or the wrong doctor, you'll get told, unfortunately, some of the wrong information. It needs to be a potent steroid, topical steroid, which in the UK is normally Dermovate, which is the brand name, clobetasol. It has to be potent steroid, and it's safe to use on the vulva area. Lichen sclerosus needs that. It's not like psoriasis or eczema where you're applying it on larger areas of the body. You're using a small amount, so it is safe to use. It doesn't thin the vulva skin if you're using it correctly, the right amount in the right areas. And like I say, it needs to be potent steroid. The guidelines do change slightly, because obviously we are all different, so we might have to have slightly different treatment. But it's normally once a day for a month, and then every other day for every other day for a month after that, and then the third month is twice a week. But they are guidelines, everyone's different. Some people only need a month of daily and then can drop back down. Others will need the full 3 months of daily steroids. And some are told twice a day, but normally the guidelines is just steroid to be used once a day. Also needs to be applied in the correct area. So again, need to see a specialist so they can help you. We've actually got, I was involved in the Lichen Sclerosus Guide, which is not just for health professionals, but mainly really for patients or those that have the condition. And on the guide, it's a website base. We've actually got resources on there where you can actually print off leaflets. So you can, as a patient, you can take it in to your doctors with this leaflet, or hopefully as health professionals, they print them off and give them to us. And it's all about the treatment, and it tells you on there how much to use, because it's hard to know whether it needs to be a pea size, whether it's half a fingertip or a whole fingertip. Again, that depends on how much of the area you need to cover. It also has in there a diagram of the vulva, which is important, because then you can tell your doctor where your symptoms are. They can tell you where it needs to be applied, because again, that could be different. And if you're not great with the anatomy and you're describing it wrong, you could be applying it to the wrong place. And there's a piece on the back there where you can also write other things on there. Doctors can recommend, because quite often when you leave a doctor's surgery, you forgot what they said, where to apply how much. So having that is great, so that then you know exactly how much of the steroids you need to use and which one. And it's important that you are using the correct one. There are many strengths of steroids. Not everyone can use the potent steroid, but that's normally where a consultant will start with, to give you a potent steroid first. It does really need to be an ointment, because creams obviously have more ingredients in, there's more chance of having a reaction to it, whereas ointments stay on the skin better and they work better. But again, why you really need to see a specialist, because at least the first month, so they can check that the cream that you're on is okay, it's not too strong, and you're applying it in the right area. Because some people do need to have a potent steroid rather than a super potent steroid. So yeah, it needs to be checked at really, at least the first month and then 3 months in, to make sure that everything's okay with the steroid you're using.
Right, yeah. And also as well to be mindful of what products you're using as well, to bathe yourself. We had Sam Evans do a session for us a couple of months ago, and she was talking about thrush bombs, you know, and all these kind of products, these different fragrance products that you can use, but actually they're really not good for you at all.
Yeah, you definitely need to check what you're putting on your vulva and inside as well. Quite often doctors will prescribe emollients like hydromol, similar things to that to use. Just check the ingredients really, because some people still have a reaction with those. So just write down what you're using and what reaction you're getting so you know. But it's important really to use moisturisers as well. Yes is a good one, because that's obviously a moisturiser as well as a lubricant. I know Sam loves Yes. So that's a great one to use, because you know you do need to moisturise your vulva. It's no different to our faces. We seem to spend more on our face than we do our vulva, but that's aging as well, and that needs moisturiser. You know, it needs looking after. You know, don't wash with anything harsh or anything that's got perfumes in. Don't keep trying lots of things as well. Give it a chance for something to work before you swap to something else. And don't, just because someone else is using something that's working for them, doesn't mean to say it's going to work for you. So just try one product at a time and then wait until you find what works for you, and then just keep to that routine then and just use it. I know that a lot of people like coconut oil. Again, that can affect some people. So just be careful on what you're using, really. You know, a lot of people just like to use natural-based products, but you know, sometimes you need medication. Sometimes you need to use something that works for LS. So just make sure you know you're using them both together. The one can help the other. And also make sure your doctor's aware of what you're using when you do go, because it might be that that's causing a reaction and not the steroids, because dermatitis, contact and allergic reactions can happen with a lot of products that you use that you might forgot that you're using.
Yeah, that's true. Moving on to the vulval cancer. So say if someone has got lichen sclerosus, how will they then be able to identify that it's actually developed into a cancer?
But lichen sclerosus symptoms are, the most common symptoms are itching, sores, white patches. Just because they're common doesn't mean you're going to have them. It's like any condition really. There's multiple symptoms and signs, but you might only have one or even none. So don't just think because you're not itchy or you're not got white patches that you don't have LS. That's sometimes where GPs get it wrong. So yeah, the main symptoms, like I say, itching and white skin, pale patches. You can have tears, you can have sores, you can have ulcers, you can have blood blisters, you can notice a change in your anatomy, you can shrink, similar to vaginal atrophy does, the vaginal opening can tighten. You know, there are a lot of symptoms, but it's when you're using steroids for daily for at least 2 weeks, and something like a tear or a lump or an ulcer doesn't change in that time, doesn't get any better at all, then that's when you need to go and see a doctor. Because vulvar cancer symptoms can also be similar: itchy, sores. The most common ones are a lump or an ulcer. So if you've still got an ulcer or a tear, you know, or an ulcer within sort of 2 to 3 weeks, and it's still there, go back. Because some cysts can disappear by themselves, ingrown hairs can disappear by themselves, but normally they say 2 to 3 weeks. If you've still got the same symptoms, go and see your GP. Mine was a tear that turned into like an ulcer, an open ulcer, where sometimes it can just be a lump. So again, don't be fobbed off, because sometimes you're told that it could be like herpes or even a cyst. If it's still there and treatment's not working, then go back and demand to get referred or have a biopsy. Because we have got members in our cancer group that were told it was just a cyst, don't worry about it. But because they followed me on Instagram and had spoken to me before, they asked for a biopsy. Reluctantly, they gave a biopsy and was diagnosed with stage 1 vulvar cancer. So, you know, please don't leave lumps if they're still there, like anywhere else on your body. You know, get the lumps checked out, get a biopsy, you know, get referred and make sure that it is ruled out. Because although, you know, vulvar cancer is rare, especially in younger women, that is rare. There's actually only one in the UK that was diagnosed, and the youngest we've got is in our support group was 17 years old. So I know that in the UK, someone as young as 2's been diagnosed, but that is extremely rare. It is normally those that, that are in their 60s and 70s. But, like most conditions, just because it's more common in those age groups, you can't rule out younger women. I was 43, and although I was only one of 40 of that age that year, there's still 40 people that have got diagnosed. So, if you're experiencing these symptoms, don't ignore it and just ask for second or even third opinion.
Yeah, and like you said, there's just there's very little knowledge about vulval cancer. I've never heard of vulval cancer until joining your Facebook group and thinking, right, if I do have lichen sclerosus, I really need, to get treatment for it. What is the treatment like for vulval cancer?
And that depends on where it is and what stage it is. Mostly you have surgery to remove the tumour, and that can just be it, just the surgery to remove it. In my case, they couldn't get clear margins because it grew quite aggressively towards the end, and it was too close to my bum area, so they didn't want to remove too much there. So I ended up having radiotherapy. Some people have radiotherapy and chemotherapy, so it does depend on stage and where it is. Most of the time, it is surgery, and that can be, as small as removing a small tumour to removing your whole vulva and vagina area. If mine spread to my lymph nodes, so I had lymph nodes removed. So a lot of it does depend on what stage it is and where it is, but most of the time it is surgery, and then it can maybe radiotherapy or chemotherapy as well. So yeah, the treatment is harsh, and obviously the area it's in, it's not great because sitting down, sex, everything changes. It is quite difficult. Like I had radiotherapy in the vulvar area, so radiotherapy, for some people it can be like 3rd-degree burns. So having to wee, stings, move, sit, it's hard, and it's hard going. And of course you've got all the side effects after. I unfortunately was put into instant menopause at 43. I also had lymphedema because they removed lymph nodes and had radiotherapy, which is the lymphatic system where it's not working properly, which moves all the fluid around, doesn't. So I now have that in my left leg, my abdomen, my pelvis and my vulva, which is all swelling. I have to deal with that. Obviously having to use treatment for that is using tight garments, compression garments. So obviously imagine if you've got vulvar conditions and radiotherapy damaged skin, having to wear tight underwear, it just abbreviates the LS. So if I don't do that, it makes the lymphedema worse. So it's all hard, as well as pelvic radiation disease. I now have that because it obviously damaged my bowels. So yeah, there's quite a lot of side effects. Not everyone has them all, some people don't.
Yeah,
there are so many. Obviously depends on what treatment you have and how intensive the surgery is. Some people have stomas, colostomy bags, so it does depend on that.
Oh gosh.
So, my cancer did come back 2 years ago, so I had to have more surgery. And although they got clear margins for the cancer, they didn't for DVIN, and DVIN is a pre-cancer, a bit similar to pre-cancer you have for cervical cancer and vulvar cancer VIN. This is to do with lichen sclerosus, and they couldn't get clear margins for that because it started to go inside the vagina. So at the moment I'm a watch and wait, but I've been told that it's not when, it's more when it's going to come.
When,
so
right.
Waiting for more surgery, and again that could be more intensive surgery where the vagina's moved. So removed. Again, it all depends on what you have, and that's why I was so angry, because obviously if my LS had been caught early, yes, it might still have progressed to cancer, but it definitely would have been caught at stage 1, where I might have just needed a small surgery to remove the tumour, and that would have been it. Whereas all my symptoms and side effects from the cancer treatment have been because of the radiotherapy. So if I didn't need that, then I wouldn't have been put into instant menopause. I wouldn't have had all the other side effects I have. So that's why it's so important, really, for quality of life to try and get early diagnosis.
Yeah, and I guess if you'd known you'd had lichen sclerosus, you would have been kind of checking yourself just to see if if there's any changes and whatnot, and so you would have spotted it. I imagine that there's some people whereby the cancer progresses beyond stage 1, simply because they're not really checking themselves. Is that often the case?
Yes, unfortunately, we've had a few in our group that have passed away because by the time they got diagnosed, it was stage 4 and there's nothing they can do. It might have been because they were too embarrassed and ignored the lump, or it might have just been that they was misdiagnosed, or just didn't even notice because, sometimes if you're not looking, you're not going to know. So, it's why it's so important to raise awareness. Like you say, most of us have heard of, cervical cancer, but, there's 5 gynecological cancers. And vulvar cancer and vaginal cancer are what we call the poor relations of the gynecological cancers. They're not given any money for research or awareness. Just because it's rare, you need to know more, not less. And even with the HPV link, because vulvar cancer can also be HPV. So it's so frustrating that when we have smear tests, there's no information on the other HPV cancers, and there's 7.
No.
It's not just cervical cancer, but they just concentrate on there. And even though I spoke to NHS England, they won't include it, which is stupid. They won't include it in any of their information, and they won't include it in their checks. Even though, like you say, they've got to look at the vulva to get to the cervix. They won't include the others. Where just a small section letting you know of the other HPV related symptoms, and could save lives. But they're just not interested. They're classed as rarer cancers, so they haven't got the money, so they won't do it.
Oh gosh, but wouldn't you have thought while you have the person there, because you're doing the smear, that you can just have the knowledge and the expertise to check the area as a whole to see if there's anything else going on?
And even if, 8 smear tests I had, so I've had at least 8 invite letters, and I've had 8 letters of all clear. There, on one of those letters, there could be a small section just letting you know what the other HPV-related cancers are and what their symptoms are. Then I might have seen vulvar cancer and thought, oh, vulvar cancer, vaginal cancer. I didn't know.
Yeah.
I better check. But again, it's rare. They don't care. Money stopping them from doing it.
Oh, sorry. It's just maddening though, isn't it?
I've been banging my head against a brick wall now for 8 years trying to get them to do more and change, but they're just not interested. It's just so frustrating. Even the NHS websites I had to get changed because they didn't even have vulvar cancer mentioned on their HPV related information, or when it comes to the vaccine as well. HPV's vaccine is aimed at cervical cancer, but it can obviously help the other HPV related cancers. It wasn't included. I had to let them know that, and they got that changed, but I should be the one that told them it's missing. So yeah, it is frustrating that constantly, even now, banging my head against a brick wall trying to get changed. That's why things like this are so important, especially when the menopause community needs to be aware, because vaginal atrophy as well. It just makes sense really that it's included, and that's why Diane's a great help, because she included cancer and lichen sclerosus in her book. And she helps raise awareness as well.
It's just awful, isn't it, that these things are not given sufficient time and money allocated to it that there needs to be. Because I just kind of put mine down as vaginal atrophy because that's what I was told.
There is a slight shift. I've noticed in the last couple of years, because I've been doing research with many specialists for 7 years now, and a lot of them were turned down, got to the stage where to try and get the money, and they can't get the money. Normally, if it can save the NHS money, you'll get the research granted, but not always. But actually now we've only just actually heard that they have granted us money for some research for LS, which includes actually a topical estrogen cream, because at the moment the only treatment really which is known to work, which is the steroids, but a junction with that, they want to look at using topical estrogen as well, to see whether that can be a treatment for LS and not just as a treatment for vaginal atrophy. So because doctors are thinking now that maybe it can help LS, not just if you've got vaginal atrophy. So hopefully when it comes out, that will help many younger women get given the prescription, because we know what it's like to try and get HRT now if you're under 51.
Oh gosh,
Most impossible. So we need to get it earlier, so it can help stop vaginal atrophy even happening if it is given younger, and also more awareness in the fact that you can have both. You can have internal and external. Like myself, I was given Vagifem to use, When I asked for the estrogen cream to use on the outside, my GP said, no, you can't have both. I'm not going to be responsible for giving you breast cancer. I said, well, that's not the case. You know, so I even knew more than the GP then. But you can use both because one's inside and one's outside. I want to obviously treat the symptoms internally with Vagifem, and I want to treat the outside, the vulva, with a cream. So I wanted both, but he wouldn't give me both. So I then left it a couple of months and then asked to change from Vagifem to just the cream, so I could insert the cream and use it outside. But that shouldn't be the case. And hopefully with this research, it might show, hopefully it will show, you know, it will be beneficial to use estrogen cream or as a treatment as steroids, that then, you know, hopefully then more GPs will be giving it out to those with lichen sclerosus, especially those that are younger, because, you know, it should be given to those that are 45 plus anyway, whether you have symptoms or not, because, you know, estrogen is starting to decline, so we need it. So until that changes, hopefully this will help those with LS, because, you know, like we know about breastfeeding as well, you know, it alters the estrogen, but they're not giving it to us. So yeah, hopefully in time that will change.
Because topical estrogen kind of plumps up the area, and so that'll certainly help, you know, with soreness. It might help to decrease on any, you know, any tears or anything like that. I had a real fight on my hands when I was on HRT, because they'd said, oh, well, no, HRT patch alone should alleviate the issues. And I'm like, well, yeah, it's not. So I had a fight in order to get Vagifem. I had a breast cancer diagnosis last year, the year before, and I had to come off HRT. And at that point, I'd said, yeah, you know, vaginal issues have ramped up again. Can I have Vagifem? And I had a fight on my hands in order to get the Vagifem. But I did get it. And then the last time I was at the GP, I'd said, I'd really like some topical cream, you know, for the vulva area. Oh, no, you can't have both. And I was like, yeah, but I need both. You know, I need the Vagifem for internal and estrogen cream for external. No, you can't have both. And I says, right, well, in that case, I'll come off my hormone inhibitors if I don't get it. So finally she did give me tubes. She didn't realize that I was still using it alongside the Vagifem, mind you. And so when I go back the next time, I might well have another kind of fight on my hands. But you know, she was talking about the breast cancer, and I said, yeah, but it's a quality of life.
Exactly. Exactly.
It really is. It's ridiculous. Neve, can I just check, do we have any questions in the anonymous form?
We've got no questions in the form at the moment.
There's no questions in the chat.
There's no questions in the chat.
Recording maybe, and then
oh yes, that's a good idea.
Put the questions out
that's
there.
fine.
Is that okay, Neve?